Back in 2020, COVID-19 shocked the world and overwhelmed hospitals and healthcare workers. Now, 2 years later, things have changed, and a lot of that equipment that was in short supply is no longer needed. COVID-19 turned our world upside down. Billings Hospitals were overwhelmed with patients. Beds, equipment, and COVID vaccines were in short supply. At one point last year, Billings Clinic had 44 COVID patients. 16 of them were in the ICU.
We are actively trying to expand our capacity, physical spaces where we can accommodate more patients.
Fast forward a year and things have drastically changed.
So for the last about 3 weeks, we've had single-digit hospitalized patients.
COVID cases are being reported weekly instead of daily. Drive-through testing sites have closed, and hospitalization rates nationally are the lowest they've been since the pandemic began.
All of the mass testing sites are closed in Yellowstone County.
And that means millions of dollars worth of medical equipment in Billings is no longer needed. 17 ventilators, oxygen concentrators, and thousands of dollars of other life-saving equipment is now being returned to the federal government.
So we still have a cache of gloves, masks, gowns, and hand sanitizer. But all of the capital equipment, the oxygen concentrators, the high-flow oxygen devices, and mechanical ventilators have been decommissioned.
And Billings isn't alone. A huge shortage of ventilators nationwide has now become a surplus. COVID is still spreading.
But what we aren't seeing is severe disease.
And that means there's finally some hope on the horizon. In Billings, I'm Matthew Hidalgo, MTN News.